My creatinine went from 4.5 milliliters to normal creatinine of 1.11 in 1 month. Acacia fiber has helped.
In this video, the impossible story of a 50-year-old man with end-stage renal failure. Dialysis was all that was left for him until his nephrologist prescribed him a RenaFiber supplementation protocol. And here's the shocking part. In just 2 weeks, his creatinine went from 4.5 milligrams per DL to 1.1. Yes, his creatinine went back to normal. No more dialysis needed. Karen here, Doctor of Natural Medicine. In today's video, I want to talk about something that's going to change everything you know about kidney disease. In 2025, a massive meta-analysis about the use of renal fiber supplementation has been published, and it is here to show the world how to get CKD patients to avoid dialysis with fiber. Yes, this is real, and this is going to change everything, guys. Because, look, I know that a lot of you are already using my fiber supplement, the RenaFiber. I know that you already know that fiber supplementation can slow down kidney disease progression. I know that you know. So what changed, you ask? Well, since this meta-analysis has been published, your doctors are going to find out too. Because here is the thing, there is no pretending this didn't happen anymore. Most patients are still being told today that dialysis is their only option, that there is no treatment, no alternative. But it has to change now. Renal fiber supplementation can help you in all the stages of CKD, including end stage. We now have several end-stage patients documented replacing dialysis with renal fiber supplementation. And there is more. A nephrologist published guidelines on how to replace dialysis with fiber supplementation. Yes, this is really happening. We now have a meta-analysis and we have guidelines showing everyone that patients in all the stages can delay dialysis by years or completely avoid it with the use of renal fiber supplementation. So now the question is, how should you supplement fiber in order to save your kidneys? Or in other words, what can you do right now to make sure you are not losing years of kidney function just because your doctor isn't paying attention to these new studies? Because here's the thing, I truly believe that fiber supplementation can make a huge difference for CKD patients. That's why I have developed my very own supplement, RenaFiber, a fiber supplement made specifically for CKD patients. And this supplement, it's one of the very first recommendations I give to all my patients. So today, I will show you exactly how you can take RenaFiber to get the results you want. I will share with you my very own protocol for fiber supplementation. I will make sure you are up to date with the most recent studies just in case your doctor missed them. But there is more. Because while I don't use fiber to replace dialysis in end-stage CKD patients, there is a nephrologist that has been doing exactly that for years. This 50-year-old CKD patient who got his creatinine back to normal with fiber, this is just his last published case. And this nephrologist, he published his own protocol as well, which we are going to see today. So today, we are going to see both protocols, alright? First, my very own protocol, the one I used with my patients to avoid dialysis. Then we are going to see the protocol this nephrologist is using to replace dialysis. So don't miss the final part of the video because I will show you how to make dialysis optional with RenaFiber. And guys, if you think this is interesting, don't forget to send this video to anyone you know who has CKD because this may be exactly what they need. So in short, in 2025, we know for a fact that specialized fiber supplements like my RenaFiber can be used to slow down kidney disease safely. We do have protocols now, which means you have two options. You can either wait 15 years before your doctor catches up and starts prescribing you RenaFiber, or you can watch the rest of the video and learn about the protocol I use with my patients now. Your choice. So now the question is, how to take RenaFiber effectively? Take a look at this table. This is my protocol, alright? Take a screenshot right now and get yourself some bottles of RenaFiber from the link in description. This is my protocol, updated for 2026. And I will circle back to it in a moment because, as I was saying, there is a huge meta-analysis that was recently published. So I will also show you what changed recently about fiber supplementation. Now guys, before we even get into it, there is one safety tip I need to share with you. Never use a generic fiber supplement if you have CKD unless prescribed. All the info I'm showing you today are about RenaFiber. This is a fiber supplement made specifically for CKD patients, and it's safe, alright? But generic ones like Metamucil are not. You cannot do what I'm showing you today with Metamucil or other generic fiber supplements. That will be very dangerous. And guys, I will circle back to my protocol in a moment. Before that, there is a question that needs an answer. Because now you might ask, there are end-stage CKD patients out there that are taking fiber supplements instead of doing dialysis. Why is my doctor saying that dialysis is the only option? Well guys, here's the thing. We know today that fiber supplements are an incredibly powerful weapon against kidney disease, at the point that this nephrologist is using RenaFiber to replace dialysis. He calls it intestinal dialysis, aka taking some tablespoons of RenaFiber every day instead of doing dialysis. And as I was saying, we also have guidelines and protocols to get CKD patients in all the stages to supplement fiber and slow down the progression of kidney disease. So why isn't your doctor prescribing you a bottle of RenaFiber with your lisinopril? Because here's the thing, fiber supplements like my RenaFiber that are made just for CKD patients are a relatively new thing. Your doctor probably doesn't know about them yet. So, you are very unlikely to learn about these kidney-saving treatments from your nephrologist. And while a lot of CKD patients are taking fiber supplements to delay CKD progression, replacing dialysis with fiber supplementation is very experimental, alright? There is one nephrologist that's doing this. Just one. So now the question is, what can you expect when you start taking RenaFiber? Well guys, as I was saying, very impressive results are possible in some cases with RenaFiber supplementation. So let's talk about this. In this case report, a 50-year-old patient, a professional bodybuilder, decided to refuse dialysis, despite having a creatinine level more than 4 times higher than the normal range. Instead, he was put on RenaFiber supplementation, and in just 2 weeks, his creatinine went back to normal. I will repeat in case someone missed it. A man with a creatinine 4 times higher than normal didn't want dialysis. Instead, he received a prescription for RenaFiber supplementation, and in 2 weeks, his creatinine went back to normal. Now, this case report is simply unbelievable. No, really. If you tell someone that an end-stage chronic kidney disease patient lowered their creatinine by 4 times, they just won't believe you. And guys, that happened to me as well, by the way. You present an impressive case, and they tell you, no, it was just an acute condition. It probably resolved spontaneously. Yeah, been there. And here's the thing. The nephrologist that saved this 50-year-old bodybuilder from dialysis with RenaFiber supplementation? Well, this wasn't his first rodeo, alright? This wasn't his first time doing the impossible and having to prove that he actually did it. I mean, can you imagine that? You are a luminary, paving the way to creating a much-needed, less invasive alternative to dialysis, and when you publish a study, people simply don't believe you. No, it was just an acute condition. Hey guys, it's good to be skeptical. I'm with you on this. I mean, the internet is so full of conspiracy theories right now that without that skepticism, we would all be eating raw organ meat and gulping it down with methylene blue, of course. But we don't do that. We don't just believe everything we see on the internet. No, we want proof. So has this nephrologist really brought the creatinine of a chronic dialysis patient back to normal, or should we all switch to 100% raw organ diet now? Well guys, only one way to prove it. Only one way to prove that this patient actually had chronic kidney disease and that RenaFiber actually saved him. A renal ultrasound. In this paper, the author proved that his patient really had chronic kidney disease by showing the world a picture of his kidneys. And the results were clear. This 50-year-old bodybuilder who was saved from dialysis, his kidneys were only measuring 8 centimeters, guys. Do you know what that means? Normal kidneys are about 10 to 12 centimeters, but the kidneys of this patient were just 8 centimeters. And here's the thing. Kidneys don't shrink with acute kidney injury. It takes years, probably decades of uncontrolled diabetes for your kidneys to go from 12 to 8 centimeters. Alright, and yeah, this man, his kidneys reached end-stage chronic kidney failure due to diabetes. So for all the skeptics out there, yeah, you have proof now. Yes, in this case report, we see that a nephrologist is actually treating end-stage chronic kidney disease with a fiber supplement made for CKD patients. Now guys, we will see the exact protocol this nephrologist published in a moment. Yes, we will see how this 50-year-old patient got his creatinine back to normal. Before that, even more important, how should you take RenaFiber? Because as I was saying, I want to circle back to my protocol for a moment. The protocol I created for my patients. There are a couple of quick things I want to show you about how to take RenaFiber for maximum benefits. So if you are only starting to take RenaFiber now, here's how to take it. First of all, I usually recommend to take this supplement on an empty stomach, not with meals. And most importantly, at a different time from medications. RenaFiber doesn't really interact with medications, but at high doses, it could slow their absorption down. So set yourself an alarm on your phone and remember to take fiber 1 to 2 hours before or after your meals, alright? Also very important, the dose. How much RenaFiber do you need every day? Well, probably more than you think. Because you see, what makes RenaFiber great is that it's safe at high doses and that the benefits are dose dependent, meaning that you want a fairly high dose. After the meta-analysis was published, I'm starting to recommend up to 6 level tablespoons a day of RenaFiber, alright? Yeah, this huge study, it's supporting the use of fiber supplements so strongly I'm getting my patients to take more RenaFiber now. So they take up to 6 tablespoons divided in 2 or 3 times during the day. And you want to mix this amount in as little water as possible to make it dissolve faster. Now, I have also seen in medical literature case reports of patients taking the fiber with, and I kid you not, diet 7-Up at meals. This you see here is another case report of a patient taking RenaFiber instead of doing dialysis, alright? She had severe nausea and needed something she was able to drink every day, 3 times a day. It was diet 7-Up, but generally, if you don't have severe symptoms, taking the fiber with just a bit of water is better. It's not mandatory though, and you can mix it with juice or soups or smoothies, whatever. Now, something that I would consider mandatory is starting slow with this supplement and build up the dose gradually. Give your body time to adapt, alright? Remember that this is a march, not a sprint, and you want to find a protocol that works for you long term. We are not aiming at, just seeing a reduction in your creatinine at the next lab reports. That's not the main goal. We are aiming at long-term, sustained improvement. Okay guys, let's talk about the protocol now. The exact protocol that saved this 50-year-old bodybuilder from the machine. Let's look at the receipts. Because he wasn't just taking RenaFiber. First of all, he was treated for the complications that were quietly killing his kidneys. He was suffering from anemia, so they gave him iron and vitamins. He was also suffering from hyperphosphatemia. His phosphorus was sky high. So they prescribed calcium carbonate to bind it. But why am I telling you this, you ask? Because, and listen to me closely please, these treatments are not experimental and they are not optional. Anemia and high phosphorus are the silent killers of CKD, alright? But a lot, and I mean a lot of patients are walking around right now untreated. No binders, no iron, no vitamins. So, here is the harsh truth. Before you ask yourself if you need a magic supplement, ask yourself this. Am I even getting the basics? Because this 50-year-old patient, he was probably suffering from anemia and high phosphorus for years before anyone actually decided to fix it. He literally ended up in renal failure before someone bothered to, connect the dots. Make sure that doesn't happen to you, alright? Consider this my wake-up call. Force your doctor to check your hemoglobin. Force them to check your phosphorus. Stop accepting it's probably fine for an answer. And now, let's talk about the secret weapon, the experimental part. Let's see how much fiber this patient needed to stop dialysis. As I said, this man was a bodybuilder and he is a tank actually. 100 kilograms, 220 pounds of pure muscle. You don't see that every day. In the intestinal dialysis protocol, the dose is 1 gram of fiber per kilogram of body weight. So do the math. That's 100 grams of fiber a day. This patient, he is emptying a couple of these bottles per week to avoid the machine. Yep, that is a mountain of fiber, guys. That is way more than I usually recommend for prevention, alright? I use RenaFiber to slow down the disease, not to replace a dialysis machine. But here is the final piece of the puzzle, and this is also going to be useful for those of you in stage 3 and 4 of CKD. Fiber takes the toxins out, but you also need to stop putting the toxins in, alright? To achieve this miracle, the bodybuilder was prescribed a very low protein diet, supplemented with keto analogs. Now guys, this is not experimental. This is textbook. Apart from the elephant-sized fiber supplementation, everything else this man is doing to avoid dialysis, it's Kidney 101. It is the exact same protocol I use with my patients to help them avoid the machine. So, here is the bottom line. Here is the lesson. This miracle, it wasn't magic. It was a 3-step attack. 1. Fix the basics. Treat the anemia. Treat the phosphorus. 2. Stop the flood of toxins with a low-protein diet. And 3. Flush the remaining toxins out with renal fiber. That is the formula. Diet plus medical treatment plus fiber equals freedom. If you want to fight this disease, you can't just pick one. You need the full arsenal. And watch my video up here if you want to know exactly how to build your arsenal. And this is all for today. Thank you for watching. God bless you all. Bye!